what the plans are and what they are to date, just so, again, there's no confusion. Today, the committee is meeting to decide or make a recommendation on emergency authorization of Pfizer's vaccine. They'll be doing the same next week for Moderna's vaccine. If the Pfizer vaccine is authorized in the next several days, shipments could go out, and we believe that we could be vaccinating individuals as early as December the 15th. So next week, that's next Tuesday, we are likely to see the first vaccinations happening in Kentucky. Now, the very next week, provided emergency authorization is given, we believe that we will be using the Moderna vaccine as well. In fact, when we get it, may even be the end of the week of the 13th through the 19th. We've been asked to plan for that flexibility, and it's a great ask. It means we got to speed up some of our plans, but it is absolutely worth it. So we believe that in the month of December, we will have 3 Pfizer allocations. The final numbers haven't been put on anything but that very first one that's being sent out. We have received what we hope are final numbers for the 2 shipments of Moderna that are going to happen in December. So remember, Pfizer's allocation, about 2/3 starts our long-term care vaccination program run by CVS and Walgreens. CVS and Walgreens contractually will have about a week from that earliest date to get up and going and have their vaccinations moving. We hope, and it's an aggressive timetable, that we can vaccinate our long-term care community in 2 months, before March the 1st. It represents 66% of all the fatalities we have in Kentucky. So eliminating that will be a major game changer. 1/3 of the Pfizer allocation goes to frontline healthcare workers. So that next shipment, Moderna, if you can put it back up, that's 78,000 or so, 76,000 doses. That's actually going to get to go fully to our frontline healthcare workers and to EMS. The reason for that is the next couple Pfizer allocations are going to go to that long-term care program. So what that means is that all of our other acute care hospitals that weren't in the first 11 for the first week of Pfizer are going to have some allocation of this Moderna vaccine in that second week to make sure they can get some of their most important workers who are exposed to COVID vaccinated. We are working very hard to onboard all of those hospitals onto the system they have to be to directly receive it. And for those that might not be onboarded on time, we are creating partner hospitals that will provide vaccinations to the employee and employees of the hospital that may not be fully onboarded. This is really important. Our frontline healthcare workers not only deserve to be first, but it protects the healthcare capacity of these individuals not being sick and not being lost to us. So we believe that this plan, these 2 priorities, are the right priorities, and we are so excited, beginning maybe even next week, to see the first vaccinations here in Kentucky. Now, we're gonna do these groups, and then the next major group after what we've talked about in Kentucky are going to be our educators, so that we can push and push and push, not just to have some form of in-person classes, but to be able to, we hope, in this next semester, have larger and larger and safer capacities within our school buildings. We know how important it is to get kids back to in-person learning. Monday at the earliest, Tuesday at the latest, we'll have our plan on January the 4th and how red counties can still do some form of in-person learning. But there is no question that what we have to do to get back to that fully is to have vaccines offered to and given to school personnel and those in and around those buildings. But I know everybody is saying, when may? And it's going to take us knowing the amounts of vaccines we're going to get and when, And that depends on how many more are authorized and how much is manufactured. And it's really going to take patience, and it's really going to test us. We think we're talking about spring to summer, hopefully at the latest, for getting significant numbers out and reaching more and more of the population. But again, we're going to need your patience. Those who can suffer the greatest amount of harm need this first, and I think we all know that. We're just going to have to live out that value of sacrificing a little bit more and waiting a little bit longer, knowing the person who gets it in front of us is more likely to suffer a negative outcome than we are. All right. On Monday, the entities and groups in this most recent executive order, as far as restaurants, bars, gyms, fitness centers, pools, other indoor recreation facilities, venue event spaces and theaters, and professional services, are going to be able to return to the capacity percentages that they were previously subject to. So for restaurants and bars, that'll be 50% capacity of the indoor dining. But there has to be a renewed commitment to enforcing the mask mandate. Just about all of us know, and we can admit, that after an initial push and an initial good job in July, moving into August of enforcing it, the enforcement got really lax. And it could have been because people would get upset or yell at other people, but enforcing this is a difference between safe and unsafe, and people living and people dying. And so we need a renewed commitment to that. Social gatherings are going to stay at a recommended 2 households, 8 individuals. Obviously, if your household is bigger than 8, we're not telling you can't be in the same household together. Let's all be reasonable. Going back to restaurants and bars, the curfew will still be in effect. Service stops at 11, must close no later than midnight. Gyms, fitness centers, pools, other indoor recreation activities, 50% capacity, but masks must be worn while exercising, obviously not in the pool, but we have now seen that they can be worn in gyms. They can be worn safely, and that adds an extra level of protection. Venues, event spaces, and theaters, back to 50%. Professional services, back to 50% of employees. All employees who are able to work from home, though, really should still be working from home based on where we are and what we are seeing. We believe that this shock to the system is working. We'll talk about one indicator that shows that. Now, we do have the highest number of cases that we've ever had today. Even with that, we're tracking about 800 fewer cases than last week. Remember, we got to plateau before we can decrease. When we talk about COVID being a fast-moving train, it doesn't just immediately turn. You got to slow it down, stop it, and turn it around. And we still believe that's what we're seeing. Even if the cases are so high right now, we want it to immediately decrease. We may also be seeing some of Thanksgiving and the impact in these numbers, that we could be moving in the right way, but still Thanksgiving has a major impact. I could tell you that if we're seeing Thanksgiving's impact, it's a lot less than what we are seeing in some other states. So today we're reporting 4,324 new cases of COVID-19. That brings our total number of cases to 213,450. But for the 7th straight day, our positivity rate is decreasing. It's now 9.13%. And that's what Dr. Stack would call a leading indicator. That shows he believes what we're going to see in the future. And that's a very positive development, one we're going to have to watch closely. Remember, COVID spreads aggressively. So at any time that we let our guard down, certainly things could turn in a different direction. Kentuckians currently in the hospital, 1,756. In the ICU, 442. On a ventilator, 231. New cases by county: Jefferson, 659. Fayette, 368. Pulaski, 135 in one day. Kenton, 132. Boyd, 119. Boone, 115. Warren, 106. McCracken, 100. Hardin, 93. Davis, 82. Madison, 78. Campbell, 65. Taylor, 64. Russell County, 61. And the others can be found on kycovid19.ky.gov, but there are counties on here with large numbers, especially for population. So again, showing it's dangerous and it is everywhere. Today, we've also lost 28 additional Kentuckians. And remember, deaths follow cases. And we've had weeks of very high cases, which means we're going to lose more people before we can start decreasing that number. These are 28 families across Kentucky that are hurting and that need your help and your care and your kindness and your compassion. So light your homes up green. It's the color of compassion. It's the color of renewal, knowing that while these individuals are gone, their body is just a vessel. Their spirit lives on and they're going to a very special place. So today we mourn the loss of two Adair Countyans, a 72-year-old man and a 61-year-old man, a 63-year-old woman from Barron, a 61-year-old woman from Boyd, a 71-year-old man from Casey, a 94-year-old woman from Christian, an 83-year-old woman from Clinton, a 92-year-old woman from Cumberland, 95-year-old woman from Fayette, 78-year-old man from Fleming, a 93-year-old man from Henderson. We lost two individuals from Hopkins County, both women, 170 and 196. From Jefferson, we've lost five individuals, a 91-year-old woman, and then a 70, 88, 69, and 72-year-old men. 75-year-old man from Martin County, 96-year-old woman from McCracken County, 92-year-old woman from Montgomery County, two Oldham County residents, 97-year-old woman and a 99-year-old man, a 59-year-old man from Owsley County, an 81-year-old man from Russell and an 88-year-old man from Russell County, 85-year-old woman from Taylor, and a 74-year-old man from Wayne County. Today's memorial reminds us that these are more than just entries on a spreadsheet and ages and genders and counties. These are real people and they're special people. They're community pillars. And today's memorial is certainly for a community pillar. It's Reverend Gregory Smith. So today we share the heartbreaking loss of Reverend Dr. Gregory F. Smith, a beloved pastor in Louisville who led the Hill Street Baptist Church for nearly 40 years. He passed away one day after his 69th birthday. Reverend Smith lived by the message of love thy neighbor. His life was dedicated to service to others, from leading his congregation to mobilizing people to help those impacted by natural disasters across the country. Reverend Smith was there for those in need. His daughter Caitlin described him as the most joyful, kind, and giving person that has ever walked the earth. And his work wasn't for recognition. He did it to make a difference. One example is how he personally helped pay the tuition for some students at Simmons College of Kentucky, where he was on the board of trustees, something his family didn't even know of until his passing. His daughter said, "This was just who he was. He was always looking to share. He'd give whatever he had to help others." He was a man of faith, and he lived through his faith each and every day. Caitlin said whether it was 3 a.m. or 1 p.m., if her father received a call from a member of the congregation or a friend, he'd drop everything to be by their side, wherever that was. From a hospital bedside to traveling out of state to support someone mourning the loss of someone he never even met, Reverend Smith was there. The impact of this man stretches far and wide and can easily be seen through the words of his grandson, who wants to be just like him when he grows up. Smith left behind his wife of 34 years, his 3 children, and his beloved grandchildren. Our thoughts and prayers are with the entire Smith family and the members of the Hill Street Baptist Church. To his family, to his flock, we are so sorry. We mourn the loss of an amazing individual, and we mourn for you and how that loss is going to impact you. For you, we promise to do better, to make sure we don't lose other individuals like Reverend Smith. Knowing the pain that you're going through, the difficulty of saying goodbye when you lose somebody during COVID, and knowing that your dad, loving his neighbor, would want us to work as hard as we can to protect other people out there. So today, we mask up in honor of Reverend Smith. Today, this Capitol is lit up for Reverend Smith and every other Kentuckian we lost. Today, that wreath we hung in the front of the Capitol with its green lights that light up the night sky is honor of Reverend Smith and the other Kentuckians that we've lost. Long-term care facilities. This is the reason that we have the vaccination plan that we do. 239 additional residents testing positive, 130 additional staff, 45 additional deaths. Now, I want you to look at some of these numbers. I mean, since the start of this pandemic, 12,075 residents contracting COVID, 8,627 staff. And remember, when we think about priority and the why, first of all, this group is dying. 2/3 of all of our deaths. We have a moral obligation to prioritize them for this vaccine, a moral obligation. And nobody tell me that these folks are old and therefore shouldn't get it first. Every day, every week, every year that we're on earth is a gift. And it's important to each and every one of our family members. But second, when someone in a long-term care facility contracts COVID, oftentimes they need hospitalization. And the amount of resources in the hospital is significantly greater than for many other patients. So this priority also gives us increased hospital capacity by freeing up a doctor to see more patients than she or he otherwise would have had the opportunity to do. So if you don't see that it's just the right thing and the moral thing, understand it's something that provides more hospital capacity as well. All right, we're going to go to Dr. Stack, who's going to talk about hospital capacity and I think a few other things. Steve?
Thank you, Governor. So I get my glasses back on here. So I'm going to talk about 2.5 things here today. The first is the hospital capacity. Jim or James, could you please put up the image for that? So I want to walk through it. There you go. Thank you. So I want to walk through part of the way we look at hospital capacity. So this is obviously a map of Kentucky. The 10 hospital preparedness regions are shown here, numbered 1 through 10. 4 of them have a red color and the other 6 are blue. The ones that are red are where ICU capacity is currently filled beyond 80%. If you look down at Region 10, this is Adair, Casey, Clinton, Cumberland, Greene, McCreary, Pulaski, Russell, Taylor, Wayne. I'm sorry, I got our interpreter here to have to work really fast. Those counties, you can look down there and see it is 97.8% of their ICU beds are full. That's not good. If you look just to the left, region number 4, I won't read those counties in respect of our interpreter here. There's 92% of the ICU beds are full. If you jump up to region 6, this is Northern Kentucky, it's over 81%. And if you go out to the eastern region, so this would be Pike County and the surrounding areas, 90% full. This is important. When you start going over 85%, now again, I'm giving you rough numbers here because there's never an absolute precise number. It's not a magical single digit number. But when you go over 85% full, you have to start making difficult choices because not every bed, not every staff member can care for all the same sorts of people. Not every ICU does the same sorts of intensive medical care. Some specialize in cardiac recovery patients right after an open heart surgery. Some specialize in neurological or neurosurgical patients. Others specialize in pediatric patients that we typically or rarely would ever use for an adult patient. So you start having to make more difficult choices, including having to postpone or defer surgeries or procedures for patients who would have to stay in the hospital after those procedures. So I'll give you an example. People who have large aneurysms in their aorta come into the hospital, have a major surgery oftentimes. Now we can do some less invasive things, but many of them still have a major surgery and may have to stay in the hospital for multiple days in the ICU in the regular hospital. If that is not immediately emergent, they may have to postpone a procedure or a surgery like that because they can't occupy the ICU bed with that person after their surgery. So when you look at a map and see that 4 out of our 10 regions are over 80%, and of those, 3 of those 10 are over 90%, that means those health systems are starting to in those regions are having to start make difficult decisions and choices. The problem that has happened in other parts of the country is when you have entire large cities, which have populations bigger than our entire state, or even entire states in numerous regions, find that their whole hospitals get filled up and exceed capacity. These are part of the reasons we've had to make the decisions we've made to minimize the spread of this disease. And in Kentucky, we're 10 plus months into this journey now. And knock on wood, we've not yet had a single hospital who has collapsed for inability to care for its patients. That's not accidental. And it would be a false conclusion to say that that was just, it's not a big deal. It's a very big deal. And the state government, through Governor Beshear's actions and the recommendations of public health, and the active partnership with the hospitals and other healthcare providers across the state, have helped to make this so. And so I'm very grateful for the healthcare community, but I also know they're facing strain. And at best, we could say that we're sort of stable or treading water in the last few days. But at worst, there's still some indications we could have some increases in certain types of patients admitted to the hospital for COVID. So I think the jury is still out about what will happen over the next 7 to 10 days when we see the impact of Thanksgiving and our choices over that holiday. But I have no doubt at this point, when I see how the test positivity is decreasing in the face of pretty stable testing overall, and I see that the hospital admissions are not rapidly escalating, even though they're not receding as nicely as we would want or as quickly, that I think the actions we took in these last couple of weeks have clearly had the beneficial effect we hoped. And now we have to see how much of our choices over Thanksgiving undoes or undermines the other successes we've had. This leads me to say we are going to enter now on Monday, December 14th, the the current executive order, the phase after that. And again, there's self-fulfilling nature to this. The vast majority of Kentuckians understand this is a serious problem, that our actions determine our fate, and that their actions individually and collectively really matter. And we have said over and over, and I know I have said very repeatedly, I want to inspire people to do the right thing. I want to try to share the reasoning, the rationale, the underlying evidence that we use to reach these conclusions. We want to inspire folks to do the right things. And Kentuckians have shown overwhelmingly they can do this, and they have chosen to do it. And I want to thank you. I really want to thank you. A portion of society has determined, for whatever reasons, they don't believe this, they don't want to follow it, it's an infringement in their autonomy. And I respect that people have different opinions, but those actions and those decisions have been the direct contributor to why this problem is as big as it is right now. So as you reflect over the weekend, and as you think about beginning the next week on Monday the 14th, I ask and I urge all of you to be kind, to be caring, and to please remember that your individual actions really, really have impact. And if you ever wanted to know a time when something as simple as wearing a cotton mask could have so much beneficial impact, here you have it. And I want to thank you. And you all have choices. We want to support our local businesses, our bigger businesses. We want to keep the economy going. We want to keep people working. We need all of that. There's a lot of other benefits associated with that. But how we do that is determined by all of our behavior and how much dysfunction this disease causes in other ways. And so you have a choice. You have a choice about your own actions, which includes wearing a mask and staying socially distanced. You have a choice about whether you host gatherings in your house, outside your own household. I discourage anyone from hosting gatherings of people who you don't live with over the month of December until we get to the other side of this journey and the vaccine is starting to flow and we have hopefully a better sense if we're going to be able to really turn the tide and get to the other side of this horrible journey. You also have a choice which businesses you support, which ones you complete your sale, and which ones you don't. And if there are places that people are in large-scale non-compliance, I urge you to consider, demonstrate through your actions what kind of behavior is important to you for the health, well-being, and safety of yourself, your family, your loved ones, your community. Think about those things. If we permit it, we promote it. And so we all have to have a role and a place in helping these voluntary and sometimes mandatory. The mask mandate is still a mandate. You're required to do that. But please, we want to inspire people to do the right thing. Now, I also want to briefly talk about the vaccine. So it's a 53-page document today that went in front of one of the committees for the FDA. I haven't had time to read it because we've been working all day trying to figure out how to deploy this vaccine. I want to share that in affirmation of what the governor said. There's 96 acute care hospitals in the state, and I want to give a shout out and a celebration to yet another dedicated public health team. The immunization branch here at the Kentucky Department for Public Health is putting in extended hours and working really above and beyond to make sure every hospital gets across the finish line in time to be included in that first round of vaccine available to all hospitals. And this will be the Moderna shipment. Not all hospitals will cross the finish line, and we're trying to reach out to them personally, like the governor said, to make sure they can buddy up or partner with someone else. So we're doing a lot. I spoke with my team to almost 600 representatives from hospitals across the state for almost an hour and a half a couple days ago, orienting to the program. And of course, we must speak to thousands of people every week trying to roll these things out. Things about the vaccine to share. It is for people 16 and over. There's a lot more data that has to be reviewed in the application. And then the advisory committees will recommend if there's any considerations for different populations who might benefit more or less, or where we might prioritize. And then a different committee will recommend which population should be in that phase 1B, 1C, phase 2. And all of us are doing our very best to try to figure out how we use this scarce resource at the very beginning to have the greatest positive good for the people who most need it and help to restore as much of society as quickly as possible to the normalcy we all miss and want to get back to so quickly. I have to ask, I beg, patience, tolerance, understanding. Whether you're a healthcare provider or a healthcare facility or a business who considers yourself essential, or a place of educational instruction, or any other part of society. It's going to take some time to work through this. But to put that in perspective, in 10 months from the time we had our very first patient here in Kentucky that we found, we now have a vaccine in just over 10 months. That is a modern medical miracle. And now it's going to take a few weeks to a few months to ramp it up, to get it deployed to the people who most need it, and then to get it available to everybody as soon as capacity allows. That immunization branch I mentioned, those workers here at the State Department for Public Health, have 600 or more vaccine administration sites who have signed up to go through the process to get set up. And I know that's just the beginning. There'll be more after that. If you have questions, if you have uncertainties, you want to know where you're going to fit in this phase deployment, I appreciate that. I really do. And we all want those answers. They're not there to be had at the moment. Those are things that are all being worked out in real time as we work with leaders across the state at the local level, at the state level itself, and with the federal government. Today, a bunch of us were on a call with General Perna from Operation Warp Speed, going through logistics and sharing concerns and lessons learned across the states in our region. So I'm very grateful for the partnership we have at the federal government and at the local governments, and our local health department colleagues who have been invaluable all along this journey. So I just ask your patience and your understanding as we go through the next few months of this, and then hopefully we emerge from the winter in a much, much better place. And then the final thing I'll say, this vaccine offers great promise, but because it will take time all the way past the summer to get to enough people to produce enough protection in the community, and because there's still more things we need to know, such as how long will the protection last? How big is the protection? How well does it protect against any of us transmitting disease to other people? It may make the disease very mild for the person who got it. That's wonderful. But it may or may not prevent you from getting infected and spreading the infection. Those are all things we have to work through and learn. But all of this is part of the process, and the fact we've done it as quickly as we have is absolutely astounding. So I want to thank you very much, and I want to thank all the state employees and the public health community who's worked so hard. There's a lot of really tired people who have tried to help get all the other people who are hurting because of this difficult pandemic back to work, back to school, and back to our other activities. So Governor Beshear, thanks for the opportunity to serve, and thank you for your leadership, and I hand this back to you now.
Well, thank you to Dr. Stack. We're going to open it up for questions. I've got written, and we have folks on the line. I'll start with Karen Czar's question. You took office 1 year ago. If you'd known what you know now, would you have still run for governor for this particular term? Karen's right. I took the oath of office 1 year ago today, standing on steps in front of a large crowd, which we don't see today, working in a full Capitol filled with people passionate about different issues, which today stands relatively empty. I started my term restoring voting rights to what's now almost 170,000 people, of protecting health care by rescinding a Medicaid waiver to 100,000 people, and think about it, right before a pandemic, of prioritizing public education through a new board of education. I even had the opportunity to submit one of the best budgets that we'd seen in more than a decade, and COVID hit. It's been difficult, just like it has been on all of you. It's been emotionally, physically, mentally difficult. That's no different than any other family. And on days where, you wonder, on days where you think, and today is just like yesterday, in a job where normally you get to travel all around the state, where all the bells and the whistles and the pomp and the circumstance has been peeled back, and you have to make decisions every day about life and death, I would still have run to do this job again. I would have still taken it on. This is the most important thing I'll probably ever do in my professional life. And I know the decisions I make will determine whether some of your loved ones are around next year. Even with criticism, even with a militia storm in the front of the mansion, it's worth it. I mean, I ran to help people, and I thought that help was going to be in different ways, but helping people stay alive, I think, is one of the most important things you can do, given an opportunity for me to try to live my faith every day of loving my neighbor. So yes, Karen, I would do it again, even knowing what we face. All right, Shelby Lofton from WKYT.
Governor, during the last flu season, the CDC shows less than half of Kentucky adults received a flu shot, which puts us in the bottom half of states for vaccinations. Do you feel the low rate of flu vaccinations will mean many Kentuckians won't receive a COVID-19 vaccination?
That's a good question. And yes, it's cause for some concern, but what we have gone through since March the 6th, I think people realize how important getting this vaccine is. Now, they need to know it's safe. They need to see others take the vaccine and trust the vaccine. Some of their own community or faith leaders. We're going to have to make the case to the public of what I believe that this is safe. But I truly believe that with the effectiveness of this vaccine, that there is a major shift occurring between those wary and those ready. And I think while we will have a campaign, and it's to talk to people about the vaccine and help them make that decision, I think our biggest worry isn't getting enough people to take it. It's people being patient to wait until they will get it, to wait while somebody who is more vulnerable to this virus gets it. I believe that's where we're going to be here fairly shortly. All right, David Mattingly from Wave 3 News. Several hospitals in southern Indiana are reported to be at or near capacity. That's true. Indiana today stopped some forms of elective surgeries. Is it creating a problem for hospitals on this side of the river as Indiana residents seek out other sources for health care? On that side of the river is Louisville. And Louisville is certainly feeling some strain. U of L cut back on some of its elective procedures. It opened a new floor to help see COVID patients. But right now, we believe that we have capacity in the Louisville area. And I know we're not going to turn away individuals from southern Indiana that need help. And we are all human beings, and we have a duty to help those in our community, even if they may be residents of other states. We do have a field hospital that we can construct if and when it's needed in the Louisville area, but we are not there yet. And if the steps that we have taken continue to show effectiveness in the data, and if people will recommit to wearing a mask, and those groups that are going back to 50% enforce it, we believe we could even see a lessening of the strain on our hospital capacity. And that also means we're going to have to do Christmas safely to ensure that we don't have a large outbreak of cases right afterwards. Catherine Collins from WLEX.
Thank you. Governor, did you ever consider extending these latest restrictions and considering past calls for personal responsibility like the red zone recommendations earlier? They did not slow the spread. Do you think this call for increased personal responsibility will be different this time around?
Well, there's a lot more cases at the moment, and sadly, there's a lot more death. Look around the country at what happens in places, and we'll show this on Monday, where there are no rules or restrictions in place, like South Dakota. It makes what happened in Florida over the summer look minor if you adjust it by population. We always expected for this to be a time-limited shock to the system. That's what worked in July, and we are seeing trends in the data that show that our steps have been working. The question is, will what people did over Thanksgiving potentially overwhelm that? Even if it does, our numbers will be significantly below where they would have been without those steps. We need not just that additional personal responsibility, and I hope everybody calls for it. Media, local leaders, families, individuals who are out there, leaders of businesses, everybody needs to be calling for it and expecting it. But we truly need those businesses where people come together and congregate, where that's part of the business model, to push a lot harder. It's the difference of stopping the spread of this virus and continuing the spread. And it's the best way that we'll be able to stay at those capacity restrictions that we're going back to. Right? Have people wear masks, enforce it. If you're a restaurant, don't serve people who walk in and refuse to wear it. I know that might not be the best thing for business, but COVID's spreading and potentially killing people in your business, both isn't right and certainly isn't a good thing for business either. All right, when can we expect more details to what conditions schools should meet in order to safely resume in-person classes? We hope to have that Monday. Maybe Tuesday. We're still working through a couple of issues, and we want to make sure that we get it right. Joe Ragusa from Spectrum.
Hi, Governor. So I want to ask specifically about Brood Cafe in Lexington, which just got its food license back after it was taken away late last month when they didn't follow the restaurant guidelines you put into place. What are your thoughts about that?
Well, my belief is everybody has to respect the rule of law. And when the Supreme Court says something is legal, we can't simply disagree and do whatever we want. Provided that Brood agreed to now follow what's being put into place, we hope that they can be successful. But we have an obligation to our fellow human being as well and to the law, and I hope that they will follow it in the future. Kevin Wheatley from WDRB.
Hi, Governor. I got a couple of questions. On the school reopening plans, the Kentucky Association of School Superintendents released their recommendations yesterday, and I wanted to get your reaction on one aspect of that. They're looking for more refined local data and possibly raising the thresholds on the coronavirus incidence rate map to better guide their local decisions on whether or not to open schools. And secondly, what do you say to superintendents and other school leaders who believe that they should have been the ones to make the decision on closing schools versus an executive order?
Well, let me answer the last one first. Superintendents out there say that to you in the media, and then they call us saying, don't put this pressure on us, right? You can't have it both ways. We reached a point where it was no longer safe. We were going to have a surge after Thanksgiving. The tool that we put in place to make determinations not only was fully read, but instead of 6%, which we normally set it for, we reached 10%. As far as the color-coded map, we didn't create that. It was the CDC, and the CDC set the levels, and that's what they originally said was safe or unsafe. Now, we're working on a way that we believe that we can operate schools safely, even in red zones. But we want more localized data. The data that was originally requested and agreed upon was that map. I mean, there's not liking the outcome, but that is some of the best data on what is going on in your community. On top of that, we have a dashboard for every single Kentuckian showing every reported case by school, number of quarantined students, number of quarantined teachers. We had 10,000 quarantined students before I made that decision. 10,000. So, tough decisions aren't easy, right? That's why they call them tough decisions. And we're going to make sure that there are protections for employees in the school. I repeatedly hear people talk about schools in a way of the kids being safe, and that is so important. Those are my kids that go to those schools, but they totally ignore the staff in the building. We've lost a custodian, 2 bus drivers, a teacher, and a student. And that's just what we know about. We've shown specific examples from some private schools about the spread through a school and the death of a grandparent. So this is real. And we've got public health guiding us every step of the way. Sure, it's not popular, though there's significant support out there for the steps we took. It's not going to be popular with some parents, but that's what leadership's about. It's not the number of emails that you get complaining, it's doing the right thing. And all we're trying to do is the right thing, and we think that we're going to have a good and a clear plan. But it's one that's got to provide real protection to the employees and not simply be a decision that one individual makes and everybody else has to be in that building no matter what. Tom Martin, WEKU. After healthcare workers and nursing homes prioritizing the order of vaccination, determining who is and who isn't classified as essential worker, kind of sounds like the sort of terrible philosophical, moral, ethical issues that philosophers are faced with all the time. What are your discussions like when it comes to those next levels? Everybody believes they're an essential worker, and everybody is essential in this world. And this who do we value more here or there? You're right. It's terrible. How do you decide between essential worker A and essential worker B? Now, with that said, there is significant discussion on the federal level about whether that is the next right step or whether it's perhaps age. And if I took their reasoning, and we haven't heard all of it, and put it in terms of Kentucky, 66% of our deaths are in long-term care facilities. The next 25% are people 60 years and older outside of long-term care facilities. That's 91% of all of our deaths. So there are different foundational reasons for different decisions for their recommendations from DC, and we will continue to watch and to listen to what they are. Sarah Ladd from the Courier-Journal.
Yeah, thank you. I was hoping to hear more. This is regarding restaurants and some of the restrictions that were lifted that you announced today. Hoping to hear more about the thought process of that. I know that, you know, we talked about the positivity rate being lower, but then we still got a pretty high positivity rate even with it lowering, and we're still seeing really high cases and deaths. So what kind of indicators are y'all looking at as far as loosening those restrictions, and what's the kind of thought process there?
Well, it was always intended to be a shock to the system, temporary, and it was a week longer than what we did in July, which worked. We plateaued an exponential growth there, and we at least see indicators that that's happening now. Again, we believe that it absolutely would be happening. Our only question is, what impact does Thanksgiving have? And then we balance certainly the damage to families and small businesses. But as we watch, especially that positivity rate, which is a leading, not a lagging indicator, and that's Dr. Stack's words, it is showing us moving in the right direction there. 7 straight days of it decreasing, and we think that is going to continue. That's going to go down before our case numbers go down. So again, we think this limited step is going to really help us, but we've got to enforce that mask mandate. We have to. That's the way we don't have to take steps like this again. Stu Johnson from WEKU.
Good afternoon, Governor. Going back to Dr. Stack's presentation, and where he noted on the map of the 4 areas with the ICU capacity high, is it feasible, number one, to transport patients from ICU to neighboring counties? And if so, do you see that happening?
I tell you what, as long as Dr. Stack's still here, given that he worked and has worked in an ER for most of his career, let's go to him.
Yes, thank you, Governor. So it's a good question. In a normal world, you may have an individual hospital who has a problem, or you may have a couple or a few hospitals have a problem. This is not a normal world. What you have is a massive pandemic that is straining hospitals all over the place. So people should not take solace that if we act irresponsibly and we allow this disease to spread rampantly, that there's going to be a place to go. Now, I don't say that to add to your fear, but I mean, it is hard enough on a day-to-day basis in an emergency department to arrange some transfers to other facilities. In a time when hospitals all over a region, a state, and a whole region of states in the country are all strained at the same time, no, you cannot just say it's somewhere else to be sent to. And the governor talked about, or I think there was a question about, the Indiana hospitals. See, they're being strained. And then what they may do is try to transfer south of the river into our state, but our state is already being strained. So we will obviously help all Americans. Healthcare providers and hospitals are here to help everybody as best we can. But no, I'm going to really put a bright line on this. This is a serious problem, and it's not reasonable to hope for relief just in a neighboring hospital who itself may also be strapped.
All right, Tom Latek from Kentucky Today.
Thank you, Governor, and good afternoon. Yesterday, the Senate majority held a press conference talking about their priorities for the next legislative session starting in January. And of course, one of them is making adjustments to a governor's emergency powers. And I was wondering what you thought of their plans to, shall we say, scale it back. And I'm also wondering, there have been reports of cyber attacks on virtual learning systems for schools. Has there been anything like that in Kentucky?
I haven't heard of what we would classify as a cyber attack. There have been some absolutely inappropriate, I don't want to call them pranks, that's intrusions, but not in the cyber attack way. And Tom, that was a very kind way, I think, of saying what was said in the Senate Majority's press conference the other day. I think what I heard was Senator Thayer saying that this last election wasn't about the president or the presidential election. It was all about me, and voters want Republicans to fully be in charge of the state, so they're going to take the powers away from a Democratic governor. First, I want to say I'm surprised because I thought Senator Thayer was a supporter of President Trump, and to think so little about a sitting president up for re-election is pretty surprising. Second, I'm flattered that he thinks that I'm a bigger deal than the president he supports. I certainly don't think that's the case. But in all seriousness, a couple of things. First, they're wrong, and they can just look at the data that's out there. We've had two sets of data just since the end of October. One was a Spectrum Ipsos poll, I believe, that talked about, can we put up the 63% of people, that's two-thirds of people don't agree on anything right now, agreeing on what we're doing during COVID. This other number, 66, that was from exit polling. Those are the actual voters that the Senate majority were talking about. They were asked as they left, after voting the way they did overwhelmingly in favor of President Trump, how do you feel about my handling of COVID? And in an electorate that voted significantly Republican, they approve, and this is an approval on anything that pre-pandemic people in public office would kill for. I mean, we fight just to get above 50% on a normal basis. So it's not based in fact. None of these are political polls paid for by anybody. These are all actual data from voters and or an independent poll. So that's just not what people think. But here's the second part. What I heard, I think, is un-American. What I heard was exactly what George Washington, our founding father, in his farewell address was talking about. He said, beware of political parties, because there will reach a point where people care more about the power of their party than the basic foundations of our government. The idea that just for your party to be fully in charge, you try to take things away from another branch of government when we create separation of powers, exactly to prevent that accumulation of power. I mean, this is exactly what our founding fathers said, don't ever do. And I get how crazy partisanship has gotten, but what George Washington is telling us, what he told us in his farewell address, is that's un-American. We always have to put the country, the foundation, the checks and balances that we have created first. And so, no, we shouldn't be doing things different just because one branch is controlled by one party and the other branch is controlled by another. We believe in this system of government, and we ought to support it, even when we might not like the person that is running another branch. So I know people talk about the founding fathers a lot. How about we listen to them? Josh James from WUKY.
Hi, Governor. Regarding the plan to allow some schools in red zones to restart in-person classes if they meet certain conditions, seeing as red is already the highest designation we have for community spread, what other measures would give you pause in allowing that to go forward?
Well, an adjusted positivity rate probably being one. Certainly, if we were over 10% on the positivity rate, again, it gets really concerning there. And that's exactly the type of situation that the CDC and others that have been quoted saying that things should be open have pointed out as when it gets too dangerous. But it's really about the protection of those that are most vulnerable to this virus. And that's what we're going to be looking at really carefully over the next several days and through the weekend to try to get the best plan that we can. John Boyle from WFPL.
Hello, I'm going to ask you about the restrictions one last time. So if the restrictions are working in containing the virus, why not keep them in place longer? Because today, I think, like you said, it's a record number. Some districts have packed ICUs, and we're still talking about Thanksgiving. So now, essentially, we're going to have, almost a full cycle before another potential mass spreading event with Christmas. So what's the thought process on not holding over until these major events are, in the past?
Well, thanks for the question. I one of the things about being governor, even being attorney general, is you got to get used to one day, the questions are, how could you do this? How could you do this? And the next day it's, how could you stop doing it? And it switches fast, but it's the job to ask questions and to get to the reasoning. I understand that. This was always meant to be a time-limited shock to the system. It worked in July to plateau cases. We believe that it can work now. We're trying to certainly buy time to the start of the vaccinations, but we believe this is also a strong motivator to reinforce the mask mandate, which was enforced in July, and we saw how well that worked. We believe that we have gotten far enough past Thanksgiving that the reopening will not create a super spreader event. In other words, Thanksgiving we're really high and then people go out to a restaurant or a bar and it spreads even more. So we think we've avoided that concern. And remember, we still have restrictions in place. We might not have the same level, but we're going back to 50%. And that's what North Dakota did as their first step, right? They're one of the most dangerous places on earth, or have been. And their step was the 50% capacity restriction we have. And there's still social distancing required in the rest. So we still do have, compared to other states around us, even when we go back to the restrictions in place, some pretty serious ones in place. So we will continue to watch the data very closely, and we need everybody's best effort. All right, hard to believe it's been a year. And I want everybody to know, whether it's on this or any other topic, do my best every day. And regardless of the noise, I know there's a lot of support out there, and I'm going to continue to do my very best for you. Tough times require tough decisions, and they create tough people. And we as Kentuckians are a tough people. There's light at the end of the tunnel. Effective vaccines that we may be giving out as early as Tuesday of next week. So let's keep fighting. Let's be committed to winning. We can do this as Team Kentucky. Honored to be your governor for this last year. Looking forward to the next 3 to 7.